So my name is Mansoor Saleh. I'm an oncologist. So I came to AKU Nairobi to establish an oncology program and an oncology research program, neither of which existed here in East Africa before. So we established the first clinical research program in East Africa, dedicated specifically to oncology, but also with other diseases, and that's my role. We know that in the past, heart disease was the most common cause of death for men and women, but it was superseded by infectious diseases, HIV, TB, malaria, etc. And then cancer was the third most common cause of compromise of health, both men and women. If you look at men today, cancer is coming up to become number one, infectious disease is number three, heart disease number two. So I think men in Africa have to be concerned about cancer and heart disease very specifically. Two things. We're adopting Western habits. We are more obese today, less athletic, eating fatty food, not exercising. Those are the same risk factors for heart disease as they are for cancer. Hypertension is very common in Africa, very common in African men. That is going to cause trouble with heart disease. That's why we need to be concerned about that. So when you have hypertension as part of your genetic makeup, and then you add obesity, poor diet, lack of exercise, that's problematic. In terms of cancer, prostate cancer is the most common cause of death and cancer in terms of men. We have a fantastic study, PSA test. You do a PSA test as a screening, you will pick up prostate cancer very early. But only 10% of our cancers for prostate cancer in men in Africa are picked up because of a rising PSA. We pick it up much later because of difficulty urination, bone pain, other symptoms which are symptoms of spread. Once prostate cancer spread, the cure rate goes down from 90% down to 10%. So that I think we should do. The second most common cause of cancer in men is GI cancer, colon, rectum, or esophageal cancer. For colorectal cancer, we have early screening, stool test in the blood. We don't do that. Esophageal cancer, we don't have an early screening for that. If a patient has symptoms, not able to swallow, you have to come to the physician, ask for advice. So I think the African man does not either participate or believe or is too macho to do early detection. And that is going to be problematic. Part of the message that we need to inculcate in that symposium, which is why I encourage all men and women for that matter to come, is one, it is within us to improve our health, healthy diet, exercise, and early detection of diseases where prevention and early detection leads to cure. So at this particular symposium, we'll be having multiple topics. Topics of leisure, topics of enjoyment, but also topics of health, where we will really stress the issues of heart disease, cancer, infectious disease as well, and empower men to take it within themselves to be sure that they have a healthy living, a healthy life, and contribute to the society. So I would encourage everyone, specifically men, young men as well, but all their women folks as well, to come and attend this African Health Business Symposium on November 24th.